significant proportion of people think that people who have substance use disorders should get less priority in healthcare. Healthcare providers are not immune from this stigma. Substance use disorders are chronic diseases that require chronic treatment. Just like our patients with diabetes, for example, may need a variety of approaches, right? Some patients may do fine with lifestyle modification alone. Some people might need to take an oral medicine like metformin. Some people may need to be on insulin. It's no different than opioid use disorders. People who are receiving medication-assisted treatment are more likely to be employed, less likely to commit crime, less likely to be incarcerated, less likely to engage in high-risk behaviors like needle sharing or commercial sex work, more likely to pay child support. It reduces the risk of HIV transmission and hepatitis C transmission.
Stigma is a big part of why a lot of people don't go get treatment.
Going into a doctor's office to get help, providers forget we're human and that we're probably going through something really difficult, and that's why we keep doing it. It's not because we want to do it.
In kindergarten, when your teacher said, "What do you guys want to be when you grow up?" not one person raised their hand and said, "I want to be a heroin addict." One bad choice led to another, that eventually you're in this position where you are going to the emergency room and they're just like, just put them over there in the corner and let them detox. People die because they needed something else, but you just weren't willing to look at it, and the stigma does that.
Stigma goes against the basic concept of recovery. Patients with substance use disorders often internalize that stigma, and so their regard towards themselves goes down, and that ultimately has negative impact in terms of their recovery. Most people with opioid use disorder with treatment make recovery. Recovery is not the exception, it's the norm.
I want providers to know that medicated assistant programs, they work. And so please don't look at people with substance use disorders as people that are hopeless. They're just somebody who needs you to listen.
Have an open mind and really see who the person is, not what they have done.
And it does take one provider to say, hey, let's try something new and let's get you back to where you need to be.